Hello, everyone. My name is Jadyn Diepenbrock, and today I will be discussing a practice change subject within the nursing field. I examined the PICO question: are nurses who have experienced horizontal violence during their work shift compared to those that have not experienced horizontal violence in the workplace at increased risk for medication errors during patient care? I chose to focus on this question because both medication administration and mental health within the nursing field are important and seem to go hand in hand. Before getting into the content of my research, I want to begin by having each listener answer this question to themselves. While at work, have you ever felt as if you were the victim of workplace violence or that the work environment was, so to say, toxic? If you have answered yes, I am glad you are able to recognize signs of horizontal violence. If you answered no, that's also great. Following my presentation, I hope that each of you will be able to recognize a situation in which you did not consider to be workplace violence that actually could be, because this is a common reason someone may say no to my previous question. So, firstly, horizontal violence is defined as the intent to abuse or harm another in the workplace via an act or threat of verbal or physical violence, harassment, intimidation, or any other threatening behavior. A prime example of how horizontal violence can be recognized is by stopping negative communication styles. So, what does that mean? Well, things such as yelling, poor body language, or degradation are common examples of negative communication styles utilized during conversation. But why is horizontal violence so common at approximately a 75% occurrence rate to keep reoccurring in healthcare when we're so aware of it? As I lightly touched on previously, a knowledge deficit regarding what is reportable can be a major factor, but so can a lack of familiarity with established policies and procedures or code of conduct. When there is a negative work environment, knowledge deficit, or unfamiliarity amongst staff, what is a probable outcome? Well, simply put, an error. Specifically within this research, medication errors could be the result of horizontal violence. The prevalence of medication errors has risen over the years with an astounding 7 to 9,000 people just in the United States succumbing to death as a result of one. A nurse's ability to practice under safe and comfortable working conditions is vital to the health and safety of our patients. So now I want to move along to the CUSIN competency aspect of my research. The CUSIN Institute aims to identify necessary knowledge, skills, and attitudes nurses shall possess to improve the quality and safety of their workplace. Of the six denoted categories, research suggests two, those which are safety and teamwork and collaboration, were the most suitable. Safety competency is in place to minimize risk of harm to patients and providers alike. This can be achieved through system effectiveness and individual performance. When keeping this in mind, horizontal violence and medication errors both stem from individual performance of patient care, communication, and following policies. Furthermore, teamwork and collaboration focus on interprofessional teams, open communication, mutual respect, and shared decision making. Each of these play a role in horizontal violence, as communication in a comfortable work environment are key to the success of the nursing role. Nurses working in healthcare facilities are the focus of my research and must be aware of safety and teamwork and collaboration competencies in order to practice quality and safe nursing care for our patients. So, the literature proves medication errors can be considered a risk or harm to patients as a result of incivility, in which incivility is just another word for horizontal violence. Because of this, employers can promote safe environment for nurses and patients alike, which can be carried out by nurses utilizing the previous cues and competencies mentioned. With that being said, further research is warranted for medication errors as a result of horizontal violence, solely for the purpose of more statistical significance. So, in conclusion, incivility towards nurses is prolific in America. For example, nurses are the center of incivility on an international scale, coming from, but not limited to, other nurses, patients, visitors, and even supervisors. Nurses are the primary caregivers of patients, which proves incivility is perceived to result in medication errors and patient safety infractions. Consequently, incivility affects the nurse's ability to safely check medication prescriptions and complete medication administration preparation and administration. Furthermore, from a quality standpoint, patient safety competence is impacted related to the declining nurse relationships. This means there is a lack in the reduction of unnecessary medical risks and harm to an acceptable level by minimizing errors. Overall, effective communication during team collaboration was proven to be a key factor in increasing patient safety competence. So, for recommendations for this research, I want to first point out the importance of further research and the encouragement of reporting both medication errors and horizontal violence incidences in the workplace. Without reporting instances of horizontal violence and medication errors, statistical data cannot be relayed for proper analysis. So, in order to increase the rate of reporting, foundational and organizational recommendations can be made. On a foundational level, employers must establish clear policies, procedures, and expectations or standards for their staff. Organizationally, educational programs, mandatory staff meetings or trainings, a zero tolerance policy, and a no blame culture must be implemented to give proper education and boundaries for staff members. By implementing each of these recommendations into the nursing routine, a reduction of risk should be the outcome. To be a nurse is to hold the value of a patient's life in our hands. So all measures should be taken to reduce poor outcomes for our patients. This is why the focus of incivility and medication errors is a significant study. Thank you.